Welcome to this session produced by the Centenary of Anzac Centre at Phoenix, Australia. This information is produced by mental health experts and is for those who work in support, welfare or advocacy roles with veterans. This is not a course on professional mental health support for veterans. Instead, it is about practical support and how to refer on. We hope that you follow up this course with discussion with your colleagues and perhaps some further in-person training. There are 3 modules and it will take you about half an hour to complete all of them. You can pause the recording at any stage and pick up where you left off. There are also some consolidation activities at the end to help you reflect on what you have learned during the modules. Module 1 provides information on veteran mental health and treatments that are effective for common mental health conditions in veterans. Module 2 is about military culture and the impact it can have on help seeking and about the challenges and ways to help with transition out of the military. Module 3 provides you with a model for how to support veteran mental health in your workplace. This is based on up-to-date evidence. At the end of each module, we will provide you with some activities to reflect on your work with veterans. If you have a pen and paper handy, it will be useful to write down some notes during these times. You can also choose to complete these activities by clicking on the web page below. By the end of this course, you will have developed an awareness of veteran mental health and some of the challenges associated with it and how to support those veterans that you work with. In this first module, we are going to give you some information which is based on a number of research studies carried out by the Department of Defence, the Department of Veterans Affairs, Phoenix, Australia, or other expert Australian and international organisations on veteran mental health. In this program, we are going to refer to a veteran using the current Department of Veterans Affairs eligibility criteria. This is that a veteran is anyone who has served 1 day or more of full-time service in the Australian Defence Force. We also provide an introduction to the sorts of treatments that we know work for veterans in relation to common mental health disorders. We'll provide you with some information to help your veterans find effective help. We have good evidence which says that of over 5,000 military personnel who discharge from service each year, there are high levels of effective functioning in all areas of life reported in most veteran populations. The recently completed Transition and Wellbeing Research Study, which looked at those who have discharged from the Australian Defence Force in the last 5 years, shows that half remain as a member of the Navy, Army or Air Force Reserve, and 1/4 of those have an ongoing role in the Australian Defence Force. More than 90% of recently discharged veterans are in stable housing. More than 40% of veterans have a diploma or higher. The general Australian population rate is only about 35%. Most veterans are employed full-time or are in full-time study. And most veterans report having a partner or a spouse. This data also comes from the Transition and Wellbeing Research Program. 54% of veterans are estimated not to have any mental health disorder in the last 12 months. However, some veterans report mental health problems. The dark blue bars in this chart show the proportion of veterans who are estimated to experience specific mental health disorders within the last 12 months. The light blue line is the prevalence of these disorders in the general Australian adult population, as estimated by the Australian Bureau of Statistics. You can see that the blue line and the dark blue bars follow a similar pattern. However, the rates for recently discharged veterans is higher across all disorders. This is especially seen in depressive disorders, post-traumatic stress disorder, and alcohol dependence. We also know that many people have multiple mental health disorders at the same time. Let's look at PTSD. This chart shows lifetime rates of PTSD, that is, anyone who has ever had PTSD in their life across different sorts of military deployments. The estimated rate in World War II veterans is a loose estimate compared to the contemporary data, but the rates are very high. There are 25,000 Australian Vietnam veterans with diagnosed PTSD, and we know this has impacted on the children of those veterans as well. Rwanda involved exposure to horrific scenes and also has a veteran cohort with high PTSD rates. But not all overseas deployments involve warfare. Contemporary operations are large in size with many roles for personnel, not all of them with exposure to combat or traumatic events. There are also many training activities, exercises and other tasks when serving in Australia that have risks associated with them. Thus, PTSD rates in veterans of contemporary operations are similar to rates for those who have not been deployed at all, which in turn are similar to the PTSD rate in the general Australian population. Veterans who maintain existing supports and build new friendships after discharge are more likely to stay healthy. Military members, selected and trained to work in teams, can be good at building social support. Military experiences may also help veterans develop coping skills through resilience training or through successfully managing a range of challenging situations. One study found Australian soldiers were more likely to use acceptance coping than civilians. If changing your situation or asking for help isn't possible at the time, being able to cope with distress is a good skill. However, those who are more likely to use acceptance may be less likely to take action or ask for help when it is available. Overwhelmingly, veterans report a preference for trying ways to manage their mental health symptoms on their own. We can support that preference by giving veterans as much information on healthy coping strategies as possible. The Department of Veterans Affairs has a range of counselling, financial, family and lifestyle supports for veterans. This high quality care can be protective if the veteran uses it appropriately. Our data tells us that the majority of contemporary veterans with mental health concerns have engaged in some sort of care with a professional. We believe the experience of currently serving members is that mental health care is far more normalised within the military health system than it used to be, and veterans are nowadays used to receiving and asking for mental health care. However, veterans commonly report that if they have a negative experience with a professional, they are unlikely to go back or seek further support. Veterans also endorse the same barriers to care that currently serving military members do. They're concerned about not being able to solve their problems on their own, and they worry that others would treat them differently or disadvantage them if they knew about the mental health condition. In addition, a number of veterans seek care that is not based on evidence. There are a lot of mental health treatments targeted at veterans, and some veterans can find it hard to work out which ones have strong evidence of their effectiveness.
Conflict in families can be a source of distress for all its members. When one member of a family isn't travelling well, it can have an impact on the well-being of other members of the family. Family conflict can also exacerbate some of the symptoms that veterans may experience when they live with a mental health issue. The flip side of this, however, is that family members can also be a strong and positive influence on the veteran, as well as a source of invaluable support. The impacts of mental health conditions can make parenting and relationships more challenging at times. Veterans may be more likely to seek help and engage with mental health services alongside their families if they believe that it is a benefit to them. The close support of family is a protective factor for mental health problems and can assist to overcome the barrier of help seeking. Strong and cohesive family ties make a real difference, so it's important to support both veterans and their families. A sense of connection and belonging is essential for recovery from mental health problems, and a treatment approach that includes family is likely to lead to more successful outcomes for veterans.
In this section, we will introduce you to some of the treatments that work for the common mental health disorders that veterans experience. The GP's role in supporting veterans includes identification of mental health related symptoms, assessing risk and risk factors, assessing protective factors, and facilitating appropriate treatment interventions supported by best practice guidelines. We are well aware that the period after separation from the ADF is when mental health concerns often present. Veterans report mental health difficulties at a much higher rate than those who are still serving. We don't know for sure why this is. However, we know that the transition can be difficult for some veterans, and it is important to establish a connection with a health provider who can provide ongoing care and support. The most common mood disorders experienced by veterans are depression and bipolar disorder, and the rates of these conditions in the veteran community are higher than the general population. Depression also commonly occurs in veterans with PTSD. To support best practice treatment, veterans need good sleep routines, a healthy lifestyle, and a supportive social network to avoid social isolation. We should ensure veterans have not become excessively reliant upon alcohol or other substances. The GP is well positioned to help with these lifestyle behaviours, to assess risks, and to arrange further treatment and support. Medications can be an important tool to enhance mood and restore motivation, and can be prescribed by the GP or a psychiatrist. The GP can also refer to a mental health professional who can provide DVA-funded therapies to help with thoughts, behaviours and relationships. When someone suffers from depressive disorder, their risk of having thoughts of suicide increases. It is important that the veteran has a range of professional support people that they can turn to, including after-hours support, such as the Open Arms All Hours support line. Anxiety is another mental health condition commonly experienced by veterans. Many veterans with anxiety struggle to cope in certain situations, such as public places or stressful situations. Sometimes the anxiety can be so severe that the individual will experience panic attacks. Many individuals with anxiety try to avoid the triggers of anxiety by isolating themselves, which in turn affects their relationships and their work arrangements. A GP can assess the severity of the anxiety and then initiate treatment measures. These measures are aimed at reducing the severity of symptoms and restoring social and vocational functioning. A GP or psychiatrist can prescribe medications to reduce the effects of anxiety, and the GP can also refer the veteran to a mental health professional to provide the most effective therapies, funded by DVA using their DVA health card. Post-traumatic stress disorder is a debilitating mental health condition borne by previous exposure to significant trauma. It can lead to significant social isolation and has the potential to fracture relationships. The Australian Guidelines for the Treatment of Acute Stress Disorder and Post-Traumatic Stress Disorder, developed by Phoenix Australia, advise that the best practice treatments for PTSD are trauma-focused, exposure-based therapies. It is important that veterans' lifestyle routines and behaviours are well managed and well supported before they undergo these intensive therapies. There is no specific medication used to treat PTSD. Medication is used to manage symptoms and allow the veteran to effectively engage in their therapies. A GP can refer to a mental health clinician trained in trauma-focused therapies. The GP can also refer to a psychiatrist when symptom management is difficult to achieve. Other therapies can also be used by the mental health provider to support management of the condition. Phoenix Australia is reviewing further adjunct therapies which have the potential to provide benefit for veterans with PTSD. It is okay to feel angry. However, when people have other mental health conditions, it may affect their ability to express or get support for their feelings of anger. Problem anger is violent or aggressive behaviour that is difficult to control. Anger is commonly treated as part of a mental health condition. People can also seek treatment for problem anger separately. It is important for someone to receive an assessment by a mental health professional to see whether their anger is related to a mental health condition and can therefore be treated using a DVA health card. Most mental health professionals are capable of making this assessment, and there are a number of psychological therapies and behavioural interventions which can be effective. Irregular or inadequate sleep patterns can impact on a veteran's mental health. Veterans suffering sleep difficulties should engage with their GP to investigate whether there is a physical or a psychological cause. There are several medications that can be prescribed in an attempt to restore healthy sleep cycles. These medications are designed to be used short-term and should be managed closely by the GP. For those veterans with difficult to manage sleep disturbances, a GP can refer to a mental health professional who can provide cognitive-based therapies aimed at restoring sleep quality.
Family-sensitive practice involves appreciating the family as a system. Wherever possible, family members should be included in education and treatment planning, and their own needs for care considered alongside the needs of the veteran. This way, families can identify and build on their strengths and get access to information to best support the veteran and themselves. Family-sensitive practice is as simple as speaking to the veteran and asking questions about family. This approach can make an impact on the family unit even if all family members don't attend therapy sessions. Family therapy and relationship counselling can be beneficial for families and couples who are experiencing ongoing issues as a result of a veteran's mental health. Open Arms has a family-sensitive practice approach and is a service available to both veterans and their families.
The Centenary of Anzac Centre is funded by the Department of Veteran Affairs to help anyone who's working with veterans build their knowledge and confidence to support veterans' mental health and well-being. We have two main roles. Firstly, we have a research arm which designs and conducts innovative research relevant to Australian veterans and their current needs. We have a number of research trials currently in operation, and you can see these on our anzaccentre.org.au website. Secondly, we have a practitioner support service which is flexible to your needs as a practitioner working with veterans. We can provide case consultation support to help you with a specific case. Or we can provide general information to upskill and inform you on the latest evidence that our research team are producing. We do this through this type of online information and via in-person education sessions, answering general queries through our web form or over the phone. We have a range of specialists across different disciplines who you can choose to ask for assistance. The service is free so long as you are working with a veteran or a family member of a veteran. If you have a question that you would like answered, you can fill out our web form and someone will be in contact with you within one working day. Go to our website at anzaccentre.org.au. Go to the Practitioner Support tab and choose Consultation and Advice, and then Ask an Expert. Scroll down to the bottom where you have two options. If you have a particular veteran in mind, you can choose I am a treating veteran and have a question related to their mental health. It asks you for some information about the veteran and the questions that you have. This will allow us to direct your question to the appropriate expert. After submitting your query, our experts may need some more information and will get in touch with you. Click on Submit Query and we will be in touch.
In our work with the Multidisciplinary Advice Line at the Practitioner Support Service, or PSS, in addition to supporting clinicians, we've been able to help a range of staff and volunteers working with ex-service organisations and other support agencies that help veterans. An example of this was a case where we provided advice around ice addiction that had resulted in aggressive behaviours, homelessness, and difficulty engaging with health services. Behavioural strategies were provided to the worker to help manage the veteran's aggression, and we provided information about accessing local drug and alcohol support services as well as mental health input. The PSS was able to support a veterans advocate who was concerned about another veteran with a traumatic brain injury and untreated post-traumatic stress disorder. The veteran's wife was struggling to cope. With advice, the advocate facilitated a referral for the veteran to undergo a neuropsychological assessment, access mental health treatment for his PTSD, and the wife was supported to access open arms. A third example is when an ESO volunteer contacted the PSS due to concern about another veteran he feared was suicidal. The PSS clinicians were able to provide a preliminary risk assessment over the telephone from the details provided by the worker that confirmed there indeed was a high risk for suicide. The volunteer was provided with guidance to access a local crisis service for the veteran, who was subsequently admitted to hospital and treated for severe depression.
Now that you've completed the module on veteran mental health, you might like to take a moment to write down some notes on your own practice. You can skip ahead to Module 2 if you wish and come back and do this activity later. In your own work with veterans, what kinds of mental health problems have you encountered? Here are some things that others have said. Briefly note down what kinds of mental health problems you have encountered with veterans' families during the course of your work. Here are some things that others have said. Write down how you might describe the main types of evidence-based treatments for trauma-related mental health problems to a veteran and their family. Here are some things that others have said.